Welcome. Today, we're diving into the effectiveness of EMDR therapy for people with personality disorders, even when there's no formal PTSD diagnosis. We'll explore the latest findings from the Tempo study, which specifically looked at trauma-focused EMDR in outpatient settings. This research is crucial because many individuals with personality disorders report significant childhood trauma, including emotional neglect and abuse. The big question: can EMDR help reduce symptoms and improve lives for this group? Let's walk through the study's design, results, and what it means for treatment moving forward. I focus on EMDR for people with personality disorders. Many experience deep psychological suffering that affects multiple areas of life. Traditional treatments can be long, intensive, and costly with long waiting times. Trauma, especially emotional abuse and neglect, is common in this group and contributes to both the development and persistence of personality disorders. The Tempo study aimed to find out if a shorter, trauma-focused approach like EMDR could be effective, potentially offering a more accessible and efficient treatment option. Traumatic experiences such as abuse and neglect are not just linked to PTSD, they also play a major role in personality disorders. Even events that don't meet the strict PTSD criteria can cause significant symptoms. For example, a child abandoned by a parent may develop deep-seated fears and emotional regulation problems that persist into adulthood. These memories can be easily triggered in daily life, causing distress and dysfunctional behavior. The Tempo study recognized the importance of addressing all impactful memories, not just those labeled as PTSD. EMDR is grounded in the adaptive information processing (AIP) model. This theory suggests that unprocessed, emotionally charged memories can be activated by current events, leading to ongoing psychological problems. For instance, someone with a borderline personality disorder might be triggered by minor signs of rejection, reliving old feelings of abandonment. The AIP model supports targeting these memories in therapy, even if they don't meet PTSD's official criteria. Diagnosing PTSD in people with personality disorders isn't always straightforward. Severe emotional regulation issues like suicidal behavior or intense mood swings can mask PTSD symptoms. Sometimes, even without a formal PTSD diagnosis, untreated traumatic memories continue to fuel personality disorder symptoms. This makes it important to consider trauma-focused treatments, regardless of whether PTSD is officially diagnosed. Recent studies have shown EMDR is effective for people with both personality disorders and PTSD. However, there's less evidence for its use in those without PTSD. Some case studies in a randomized trial have reported positive effects, suggesting EMDR could help even when PTSD isn't diagnosed. The Tempo study set out to provide more robust data on this question. Tempo study was a randomized controlled trial conducted at 2 mental health centers. It included 159 adults diagnosed with a personality disorder. Participants were randomly assigned to either EMDR therapy, 10 90-minute sessions over 5 weeks, or a waitlist control group. Researchers measured PTSD symptoms and diagnoses before, right after, and 3 months after treatment. They also assessed childhood trauma exposure, including emotional and physical abuse and neglect. EMDR sessions targeted not only memories linked to PTSD symptoms, but also memories that contributed to the development or worsening of personality disorder symptoms. This included fears of abandonment and emotional regulation problems. The therapy aimed to process any impactful memory, broadening the scope beyond traditional PTSD treatment. Study found that emotional neglect and emotional abuse were the most commonly reported childhood traumas among participants. Physical abuse, physical neglect, and sexual abuse were also frequent. About 40% of patients had a PTSD diagnosis at the start, but many others still showed elevated PTSD symptoms linked to significant life events. EMDR therapy led to significant reductions in PTSD symptoms compared to the waitlist group. These improvements were maintained at the 3-month follow-up. Interestingly, whether or not someone had a PTSD diagnosis at the start didn't affect the outcome. Both groups improved. 2/3 of patients no longer met PTSD criteria after treatment, rising to nearly 3/4 at follow-up. Only a small number of participants, 5.1% in the EMDR group, stopped treatment early, and there were no serious side effects. Reasons for dropout included lack of positive experience, severe underweight, and COVID-19. This suggests EMDR is not only effective but also well tolerated in this population. Majority of treated memories involved physical abuse, emotional abuse, and other impactful events like abandonment or divorce. EMDR was effective for all types of memories, not just those meeting PTSD's strict criteria. There were no significant differences in symptom reduction between memory types, highlighting EMDR's broad applicability. While the Tempo study offers valuable insights, it's important to note some limitations. The use of a waitlist control group, while necessary for early research, means EMDR wasn't compared to other active treatments. Also, long-term effects need further study, as personality disorders often involve ongoing challenges. Future research should address these gaps. Tempo study shows EMDR can significantly reduce PTSD symptoms in people with personality disorders, even without a formal PTSD diagnosis. This suggests clinicians should look beyond diagnoses and focus on each patient's unique trauma history. EMDR could become a valuable tool for improving outcomes in this challenging population. Sum up, the Tempo study provides strong evidence that EMDR therapy can help people with personality disorders, regardless of PTSD diagnosis. Addressing all significant memories, not just those fitting strict criteria, leads to meaningful improvements. This research encourages a more personalized, trauma-focused approach in mental health care. Thanks for watching and stay tuned for more updates on trauma therapy research.